Let's talk about hypertension. First of all, what is hypertension? Hypertension is now defined as sustained multiple blood pressure readings of greater than 130/80. So how do we get there? How does hypertension develop? This is a very important question because hypertension is now the number one predictor of morbidity and mortality worldwide. In other words, hypertension kills or disables more people than any other disorder. Okay, so how do we develop hypertension? First of all, we break hypertension down into two categories, primary and secondary. Primary hypertension is also known as essential hypertension. Those two words are interchangeable. So, and also primary hypertension makes up 90% of cases of hypertension. So it's important to know that. So primary hypertension, how does it form? These are all our risk factors. Starting off with genetics. How does genetics come into play? So we got to start by talking about the organ that is most responsible for regulating our blood pressure, and that is the kidneys. So our kidneys sense changes in blood pressure throughout the day, and they're going to respond. When blood pressure gets a little bit too high, the kidneys are going to naturally diurese or excrete sodium and fluid. All right. So in someone with normal functioning kidneys, they're going to sense, oh, the blood pressure is a little bit too high. Let's get rid of some fluid and sodium to get that blood pressure on down. Some people inherit kidneys that are not as able to do this. So they're not as responsive to those changes in blood pressure. And so that's how genetics plays into developing primary hypertension. Also, we do know that a high sodium diet contributes to hypertension. Obesity and a sedentary lifestyle. Those are huge, y'all. Sedentary lifestyle is defined as less than 30 minutes of activity 3 times a week. So you got to get those activity levels up. Age. This is one that we really can't do much about, right? So age greater than 55 in men and an age greater than 65 in women. Excessive alcohol use. And I'm not talking about a glass of wine a day. I'm talking about excessive alcohol use. Cholesterol. So elevated LDL or total cholesterol or a low HDL, which is our protective cholesterol. Diabetes mellitus. That contributes to hypertension. Typically, if someone has hypertension, they're going to be diabetic as well. Tobacco use, and then prolonged severe physiologic stress because of exposure to the norepinephrine and epinephrine that are released when we are under stress. Okay, so those are the risk factors for primary hypertension. So let's talk about secondary. Secondary meaning that the hypertension is secondary to something else, all right? So the first one I have listed here is obstructive sleep apnea. So in this disorder, pressures elevate within the pulmonary vasculature specifically. And so sleep apnea or obstructive sleep apnea can contribute to secondary hypertension. Renal disease. So renal disease can be either renal artery stenosis, or it can be renal disease where the kidneys are not as able to diurese and unload that volume and sodium. Vascular disease, so vessels that are hardened and inelastic. Endocrine disorders, so long-term steroid use we know can cause hypertension. Oral contraceptives we know contribute to hypertension. And then something called pheochromocytoma, which is a rare tumor that develops on the adrenal medulla, and it secretes epinephrine and norepinephrine. This is a very dangerous endocrine disorder. And then finally, NSAID use. NSAIDs have a high amount of sodium in them. So chronic NSAID use, for things like arthritis, that can contribute to the development of secondary hypertension. So what does all this mean? All this leads to either an increase in blood volume, which increases cardiac output, or increased arterial resistance. So those arteries, those vessels are resistant to the heart that's trying to pump, and so that increases the pressures. These cause pathologic changes. So pathologic always means bad. So pathologic changes to the arterial bed and or an increase in blood volume is going to increase those pressures and contribute to high blood pressure or hypertension. An increase in systemic vascular resistance. So basically, systemic vascular resistance is a reflection of vessel lumen size. So if we have blood vessels that have a lot of plaque buildup or that are constricted, that increases the systemic vascular resistance that the heart has to pump against. This increases afterload. Afterload is a fancy word for the pressure that the heart must overcome in order to pump out blood and perfuse organs and tissues. All right, so all this leads to an elevated blood pressure, which is defined as a systolic blood pressure greater than 130 or a diastolic greater than 80. So I hope that helps. We've talked about the risk factors, the different pathophysiological mechanisms responsible for developing hypertension. We've discussed how dangerous hypertension is and the difference between primary and secondary hypertension. So I hope that you found this video helpful and have a great semester.